Hello, everyone, and welcome to the Hold On Till Dawn podcast. My name is Erin. I'm your host, and today is May 1st. It's a Wednesday. It's not a normal podcast day, but it is Mental Health Awareness Month, and May is going to be a little bit different for my podcast. I'm not going to release an episode every other Tuesday. I'm actually going to release one every Tuesday in celebration of Mental Health Awareness Month because this podcast is about mental health. And so this month is a pretty important one to me and to this podcast. So I'm also going to bookend the month with episodes. So I'm going to do one today, May 1st, and then do one on May 31st to recap the month. So I wanted to take a minute to talk about what Mental Health Awareness Month is because not everybody might be aware of it. And actually, while I was researching this topic, I found out some stuff that I didn't know as well. Such as Mental Health Awareness Month has been recognized since 1949 when it was launched by the founder Clifford W. Beers, who created Mental Health America. And Mental Health America is the nation's leading national nonprofit dedicated to the promotion of mental health, well-being, and illness prevention. That is a quote directly from their website. And I honestly have never researched Mental Health America. So after I do this episode, I'm definitely going to read more about them because this looks like a great foundation and I can't wait to learn more. So Clifford became the honorary president of the World Federation for Mental Health. He was born in New Haven, Connecticut in 1876. In 1900, he was first confined to a private mental institution for depression and paranoia. He gained support of the medical profession and others in the work to reform the treatment of mentally ill. In 1909, he founded the National Committee for Mental Hygiene, which was renamed the National Mental Health Association, which is now Mental Health America. So that is really cool. So obviously the foundation that I know the most about that has to do with mental health is the AFSP because that is the one that I have worked with for nonprofit events and fundraising that I've done in the past. So I'm going to talk a little bit about them too, because I know more about their foundation than other ones, which there are so many that focus on mental health. And May is a great time to look into them and find out more about each organization, each nonprofit, see what they do and what you can do to help if you're interested, because there is the Trevor Project, there is NAMI, there is To Write Love on Her Arms. And each organization has a different mission, but they all are about mental health. May is Mental Health Awareness Month. It was first recognized in 1949 when it was created by Clifford. And it was created as a way to educate the public about mental illness, raise awareness surrounding research and treatments, and reduce the stigma. So we use Mental Illness Awareness Month now to spread the word as much as we can. I personally love to post things on my Instagram stories and feeds about mental health all the time, but I know for some people that's not something they like to do. They may support mental health and suicide prevention in their own way, but posting all the time is not something they like to do. So May gives you a reason to post a little bit more and to check in on your friends and just start an open conversation. And you can use Mental Health Awareness Month as an excuse if you're feeling a little self-conscious about it. if you feel awkward asking your friends how they're doing, you can just bring it up and be like, oh, hey, it's Mental Health Awareness Month. Have you seen these organizations that are dedicated to it? Or did you know these facts? Or it just starts a conversation, and that's kind of what the whole point of the month is. So I wanted to talk a little bit about the AFSP. They were established in 1987. It's a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy. They're dedicated to saving lives and bringing hope to those affected by suicide, including those who have experienced a loss. So not only is the AFSP a big supporter of mental health, but obviously their main focus is suicide prevention. So they have a lot of statistics on their website. As of the data that they retrieved May 19th, 2023, suicide is the 11th leading cause of death in the U.S. In 2021, 48,183 Americans died by suicide. And in 2001, there was an estimated 1.7 million attempts. The age-adjusted suicide rate was 14 per 100,000 individuals. In 2021, men died by suicide 3.9 times more than women. On average, there are 132 suicides per day. White males accounted for 69.68% of suicide deaths in 2021. And in 2021, firearms accounted for 54.64% of all suicide deaths. And 94% of adults surveyed in the U.S. think suicide can be prevented. And something that I thought of when I first found the AFSP and saw that they were taking donations, as I said to myself, what is the money going towards? Because for a physical disease such as cancer or diabetes or something that is an illness, you know that the money is going to funding that and helping treat the illness where there's no treatment. So I can understand why people would be hesitant to donate money towards the AFSP maybe right off the bat, because you're like, well, where is my money going towards? This isn't a illness that's like cancer or diabetes or Alzheimer's or something like that. This is a mental illness. This is treating people that are mentally ill. There's depression, anxiety, there's bipolar, there's borderline personality disorder, there's mania, there's hypomania. There's so many different kinds of mental illnesses that can be treated with therapy and sometimes medication. And your donation is going towards funding the scientific research, educating the public about mental health and suicide prevention, advocating for public policies in mental health and suicide prevention, and supporting survivors of suicide loss and those affected by suicide. And I just wanted to share that because I think some people think of a physical illness and a mental illness in two separate categories, which I understand. But mental health can be just as important as physical health, because if your brain is not in the right place, then that's just as damaging and just as unsafe as if your physical health is in danger. So since the AFSP was founded in 1987, I wanted to read off a couple things that they have accomplished. They mobilized and connected tens of thousands of people who have lost a family member, loved one, or a friend to suicide. They've reached thousands of individuals who are at risk for suicide, as well as those who love and care for them. They've attracted the participation of members of the scientific and clinical communities who conduct groundbreaking research on suicide and its prevention with support from the AFSP. They've established local chapters in all 50 states, as well as Puerto Rico and DC, and they've educated hundreds of local communities about suicide and how to prevent it. And that is just some of the things. I could keep listing. The AFSP is a groundbreaking foundation and organization. And most importantly, the number one thing I wanted to mention during this episode specifically is that 988 is the new suicide and crisis lifeline. It used to be a 10-digit number, and you could call or text that. But now it's just 988, as simple as 911. And it offers free and confidential support for people in distress or crisis. And there's also a website if you want to learn more. It's 988lifeline.org. Also, if you're interested in volunteering, you can volunteer for the AFSP. You can volunteer for the 988 hotline. If you are a listener of this podcast, I want you to hold yourself accountable during the month of May and ask yourself, it doesn't have to be every day, but maybe every other day, start with, or maybe once a week, if this is something that you never do. Check in with yourself and say, am I okay? And if you're not okay, say, what are the steps I can take to get back onto the path of being okay? What are the things that I am grateful for? Who are the people in my life that care about me? Who are the people in my life that I care about? What are the things that get me out of bed and motivate me? It could be something as simple as being able to go for a walk around the neighborhood, having the sun shining down on you, having the work week almost over. It doesn't have to be anything huge. It could be something as small as that. Having your favorite song to listen to, having a friend to talk to at the end of the day. Use the month of May to check in with yourself. And also, I want you to check in on at least one of your friends this month. It might be someone that you see is having a hard time, or someone that seems a little bit off. They're not their usual upbeat self. Or it could be someone that appears to be entirely happy on the outside, and it doesn't look like there's anything bothering them. Because almost always, no matter what people look like on the outside or what they appear to be feeling, there very well might be something that they are internally struggling with, that they're having a hard time with, that they don't like to vocalize, they don't like to ask for help, they don't want to be a burden to others. So it's even important to check in on those friends that seem as if they have it all together, because they most likely don't. So I want you to use this month, Mental Health Awareness Month, to not only check in on yourself, but check in on one friend, at least one friend. You could totally do more. You could do one friend a day. You could do one friend a week. Just check in on somebody, but also check in on yourself. And that is your homework for the month of May. I'm going to do the same thing. I'm going to check in with myself. I'm going to try to do it every day. And I am going to try to check in on one friend a day. I don't think I have 31 friends, but I'm going to check in on everybody I know at least one day this month. So if you're one of my friends and you're listening to this, you're going to get a check-in text. So I'm so excited for this month. I'm so excited for the progress that we are making in mental health and what the future holds for mental health. So thank you so much for listening, and I will see you on Tuesday. Bye. Thank you so much for listening. Our website is holdontildawn.com, and our email is holdontildawn@gmail.com. You can follow us on Instagram at holdontildawn and on Facebook at Hold On Till Dawn Benefit Concert. See you next time.